I'm not your protagonist, I'm not even my own. I don't know anything, I don't even know what I don't know. Implicit biases are attitudes, thoughts, and feelings that exist outside of conscious awareness, making it difficult to consciously acknowledge and control. These preferences or aversions to a certain group of people can influence behavior that perpetuate disparities to healthcare access, quality of care, and outcomes. I'm about to examine my own implicit biases using the Harvard Implicit Association test. I started with the fat thin IAT. I wonder why they chose fat thin over obese thin or normal weight overweight. The moniker fat has its own biases. Could the authors of the test have implicit or explicit biases by using such a charged term? I don't identify as thin and have lived on both sides of normal weight and overweight, but I am a middle class, middle aged white woman who has been exposed to fat stereotypes for about 50 years. So I'm interested to see if I have implicit bias. I don't think that I do. So, my test results show that I have a moderately strong preference for thin people over fat people. I'm surprised. What does this mean? My favorite athletes and musicians aren't thin. My family isn't thin. Some of my favorite patients have been downright obese. Upon some serious reflection, my bias may stem from not only media influence, but my association of obese patients with pain and shame. Putting a Foley catheter into a 350-pound person can require a room full of people to hold up the pannus, pull back the fat tissue from the thighs, and retract labia. In my experience, this is absolutely mortifying for the patient. They feel shame, embarrassment, might cry, and I feel terrible for putting them through the ordeal. In the OR, positioning an unconscious obese patient is downright painful sometimes and dangerous. My back is still sore, actually, from trying to prevent a large man from slipping off the narrow OR table when putting him into a prone jackknife position. For my second test, I chose transgender versus cisgender. I see a disproportionate number of transgender patients in every mental health setting. I wondered if I had implicit bias because, in some ways, I have had an openly explicit bias, especially towards transgender youth. Although I am no stranger to challenging gender stereotypes, I didn't understand the generational preference for creating a gender they identified with instead of expanding the meaning of their natal assigned gender. For example, I absolutely did not identify with the gender stereotypes of the 90s. I challenged, bent, and created my own identity as a female. My transgender friends at the time were all adults and had spent a lifetime feeling uncomfortable with their gender assignation and faced huge challenges by becoming the person they felt at home with. We held gender bending balls, protested for equal rights, even marched on Washington. This sounds a lot like a back in my day story, but like I said, I think this is a generational culture bias as opposed to a transgender bias. My attitude was challenged when my youngest decided upon adolescence that they were transgender. I just thought, but you don't know what it means to live as your assigned gender yet. And if you don't like the stereotype, change it. As you can imagine, my perspective did not help my child. My lesson was how to unconditionally support my child to keep them safe and healthy. I learned that it doesn't matter if you don't understand the complex paradigm of gender identity and pronouns. It's not so much about understanding as it is accepting people where they are at. So I took the test and found I have no implicit bias for either cis or transgender. Yay, it's very affirming. What are the implications of implicit bias on social justice and the determinants of health? Marino et al. Conclude that this subtle form of discrimination affects our willingness to engage with patients in collaborative treatment and who we provide evidence based treatment to. My IAT negative bias towards fat people may influence my diagnosis and treatment in a way that wouldn't be so for my thin patients. Perhaps I have attitudes and behaviors towards fat people that may exacerbate their past traumas. making them less likely to seek help and treatment in the future. Honestly, I don't see it in myself, but I suppose that is why implicit bias is subconscious, not intentional. It bears further consideration. What are some strategies to reduce implicit bias? According to Fitzgerald et al.'s article, Implicit Bias in Healthcare Professionals, a Systematic Review, the most successful interventions to reduce implicit bias included 1. Intentional strategies to overcome biases, 2. Exposure to counter stereotypical exemplars, 3. Identifying the self with the outgroup, and 4. Inducing emotion. Marino et al. Suggests exposure to activities that engage empathy towards the group of negative bias. Having a child identify as a transgender youth greatly increased my level of empathy and understanding for the youth and their families. A less extreme and personal intervention could be the psychiatric interview and psychotherapy itself. I have found that in engaging with individuals who describe their psychic anguish of living the experience of a marginalized group improves my understanding and empathy towards the whole group. Inducing emotion with personal stories broadens my understanding of another's point of view. Intentionally questioning my intent and looking for biases may also help overcome or suppress them. Moving forward as a practitioner, I will need to continually examine my attitudes and perspectives to evaluate the impact I have on social justice and on equitable healthcare system.